Can you imagine referring to an orthopedist who never sent you a note?
Yeah.
Imagine referring to a GI doctor who didn't follow up with you. And yet we refer patients to therapists and to psychiatrists who we don't know them. We've never met them. We haven't gotten any feedback from them. They've never picked up the phone to try to call us. You do have to set up other avenues, secure email or some other way to communicate. But you have someone right there who you could hire because they want to be integrated. They want to partner and they want to have a relationship with the doctors and the pediatricians who are seeing people. And can you see more patients and see more ear infections and sprained ankles to help cover some of their time? Can they bill more case management codes, conference calls? Can they do parent consults? Can they bill more screening tests to cover some of their salary? Maybe, but it's an opportunity.
I did ask her, this was 10 years ago, when I was pivoting out of the urgent care, if she was willing to come into a practice, even if it was just sharing the spaces, like being in the same building.
Yeah.
And we didn't have to get married. We could live together. And she was like, no, I like my office. I like the way I run stuff. If you could even just get to cohabitating, not even getting married, would be great.
The part when they live, they're in the same building. I've seen that happen. We had that works well. But back to Herb saying with the medicating the children, those are the ones that actually need.
They need a lot.
I'm working on a project now for some population health for one of the managed care Medicaid programs for some value-based contract. Basically making a spreadsheet of all the PH29s, scoring them and putting them on the date. The amount of positive PH29s, it's out of control.
Yeah.
Did these kids go somewhere? I see their note. Yeah, refer it out, but did they actually make it somewhere? I highly doubt it.
So
And
I'm going to ask you.
I've spoken to some practices, right? Because we're all trying to talk to each other to get ideas. And I spoke to Peter in Rhode Island, whose practice has a therapist. I can't remember her licensing right now, but they see all the positive PHQ-9s. That's how the model is set up. Not what we do in our practice, but that's one way that those kids get at least assessed and provided with some resources.
So what's become such a...
What was the pivot? You said they got overwhelmed after 2 weeks and you made a pivot.
So the pivot was to, one, we had identified, okay, we've got a real need. We've got a lot of kids that we're referring to therapy who are interested in therapy. We had the advantage of having credentialed them with insurance companies. We're one of the very few places where they could get therapy covered by insurance. And so what we did is we actually, the next version is that we had her supervise a couple of trainees. The one person I already mentioned who was working on her ASW came on at that point and is still with us several years later. Someone else who was working on licensing for their MFT or AMFT came on. And so then that increased our ability to provide direct therapy hours. We also had to focus on which are the kids that really should be getting therapy from us, that we can do short term. Let's help you through whatever is happening and give you the resources and identify those kids who really are going to need more long-term help and help them find something else in the community that's going to give them that long-term help. That was the pivot.
I think that's key, that pivot, where everybody that's been successful in implementing this, they have a limit of number of sessions they do in-house. Like they do a quick assessment. I can help you for 4 weeks, whatever the trauma is. Your parents are getting divorced or your dad unexpectedly died. You're going to grieve, and it's normal to be depressed and anxious in that situation. And we're going to help you through 4 weeks. If after 4 weeks or 6 weeks, you're not rebounding back like you're supposed to, then we're going to refer you to this trusted source because we just don't have a bandwidth to give you therapy for 6 months because there's so many people we need to serve. But that's always, everybody that's been successful says it's a quick thing. It's a quick assessment and we'll follow you up for X number of times. If it goes beyond that, we have an external resource that we can use.
This behavioral health, has it always been here?
Where else do you think that this, what you did is you did your own project, Echo, with a psychiatrist. So were you meeting once a month or once a week?